Okay, our next talk is, David, you want to just, I can give you. Presentation 2 is Dr. Fu. Now, this is, now, promise you're not going to laugh. Do you all promise? I am sorry to say Dr. Fu has the flu. But he actually came from, he was going to be here today, and he called yesterday, he has COVID. But we were able to get him in his home in Miami area. And when we first got him, he was in his pajamas, and so he was up on the big screen. And then he went and got dressed, and we recorded his presentation, and he'll be with us live on the mic to answer your questions when we get to the question and answers. So Dr. Fu is an associate professor of clinical anesthesiology at the Miller School of Medicine at the University of Miami. He is an engaging guy, and I never really laughed so much as I did yesterday with anybody who had COVID. So anyway, without further ado, Eugene.
Okay. Hi, this is Dr. Eugene Fu. I'm sorry that I can't attend the meeting, but I'm very delighted here to give a presentation on the medical perspective of heat illness. I am currently faculty at the University of Miami, associate professor in the Department of Anesthesiology, and I will be presenting this lecture as we speak. Yeah, I'm sorry I can't be in Sarasota today, but I'm delighted to give this lecture on the medical perspective on increasing heat health issues. For disclosures, I have no potential conflicts of interest. And I want to first just give you an idea of the temperature changes that's been happening in the last 20 years or so. And basically, summer of 2023 was known as a record banner year of high temperatures. And it's showing that 2024 is also approaching that as well. And if you look at this graph, which is from the Goddard Institute of Surface Temperatures, what they did was, instead of analyzing absolute values of temperatures, what they did was they compared temperatures from a baseline period, which was between 1950 and 1980, and then compared how 2023 compares to that. And as you can see that in the summer months, there was an anomaly of greater than 1 in 2023. And as you see in 24, it's even higher than that. So basically, this is giving credence that things are getting hotter every summer. This was from the Miami-Dade website on heat temperature, and this shows you that the heat index is high, and it is higher in the 2000 from 2011 2020 versus the blue, which represents years before that, in the 1950s to 60s. So you can see that in the Miami, you have increased temperature as well. One thing is that the purpose of this lecture is to give you an idea about heat stroke and the dangers of heat illness. And one point that I'd like to convey to the audience is that everybody in the audience, because they're interested in heat education, heat adaptation, can become an expert by self-educating yourself. And one thing to look at is that when you go on a hot day and you have an event, whether it's a sporting event, a concert, or an event where it's outdoors and there's going to be a lot of people there, always try to see what will be the heat index for this for the day. And you can be able to look that up through the weather apps. And the calculation of heat index is based on this complicated formulas you see here, where you have coefficients of T and R, which reflects air temperature and relative humidity. And through this complicated mathematical equation, you get the heat index. As you can see here with the color codings from the yellow to the red, you can see the severity of the heat indexes. Now, this can be better displayed on this graph here, which you get from the weather.gov. And as you can see here, this shows you the relationship between temperature and relative humidity. So basically, I recall when my son would play soccer, there would be easy days where you're at 92. And so if you have 60 degrees humidity, you're at this 105 heat index. And so we know that in the summer months, our children can be playing in this kind of weather here, and this is already once you hit the orange, you're in the danger zone. So I want to give a medical perspective of heat illness, and I just wanted to just explain some concepts of classical versus exertional heat exhaustions versus heat stroke, and see and let you know how the medical experts in Miami-Dade try to handle heat exhaustion and heat stroke. And then I'll also want to talk to you about the pathological consequences of heat illness, especially as it relates to Florida. Okay, so who's at risk for classical heat illness? The two obvious groups are the very young and the very old. And so basically with the classical heat illness, you can get heat illness without having to do any exertion. It's just by being in the hot environment, you can get into heat illness. For heat exertional illness, this is the one we think about in terms of athletics, outdoor workers, agricultural workers, construction workers. And so then we have to ask ourselves, how do we prevent the heat illness? And preparation, is important. Like we know that medical equipment emergency plans are done, especially say at big sporting events such as marathon runs. You know that there's medical personnel involved for that to help. But education for the people who participate in the events. So parents, athletes, and coaches should be aware of heat illness. Look at the temperature readings, and then also be prepared for fluids, for the athletes or for whoever's participating in that event. Here's a slide that shows you that there are experts in the medical field that have a really exquisite understanding of how heat illness affects the body systems, whether it's kidney, lung, liver. And basically, they were able to show the difference between classic heat stroke and exertional heat stroke. And as it turns out, in a young person who gets exertional heat stroke, he or she could have worse rhabdomyolysis, which is muscle breakdown, liver dysfunction, renal failure, and DIC, which is disseminated intravascular coagulation, which is the coagulopathy. So basically, as you can see here, the young person out in the field or out in an athletic event that gets exertional heat illness can get some very severe organ damage that you might not see in an elderly person who gets classical heat stroke. So now, as I told you the difference between classical heat stroke and exertional heat stroke, getting heat illness, now it's common. It can happen to either these kind of events such as heat rash, sunburn, heat cramps, heat exhaustion, heat stroke can happen whether it's classical or exertional. So I just want to now focus in on, say a victim gets a heat illness. The first three, heat rash, sunburn, heat cramps, are more controllable situations. The danger zone happens once you get to heat exhaustion and heat stroke. And so basically, if you look here at this schematic, heat exhaustion is where there's dizziness, heavy thirst, some nausea, weakness. But you're on a slippery slope, that if you don't properly intervene, you can get confusion, dizziness, and unconsciousness. And so once you're in the heat stroke zone, you're pretty much 911. This is where you got to have medical personnel. But what I'm going to tell you is that if you're even in this stage, you still want to have paramedics involved. And this is what I'm going to show you. I have a collaboration with the Miami-Dade government, and they have a good website that shows the differences between heat exhaustion and heat stroke. And here is the web link as shown above. And I wanted to show you what the people in the Miami-Dade Fire Rescue Medical Operations Manual says. So they have a very elaborate plan of how to handle heat exhaustion versus heat stroke. So as I said before, heat exhaustion, you can get the starting of feeling faint, and then it can start with vital sign changes such as hypertension, tachycardia. And some of those victims might not be able to drink without vomiting. So you got to be careful how you deliver fluids to these victims. And then it can get to the point where even with heat exhaustion, the paramedics would need to put in an intravenous line. So even with heat exhaustion, I would advocate that you would want medical personnel on board, because the slippery slope now comes in is where you don't know when heat exhaustion slides into heat stroke. And so the heat stroke is obviously a 911 situation, and this is when the temperature is reaching above 102 degrees Fahrenheit. So basically here you're getting mental status changes. Patients can start becoming confused, unconscious, and then they can have total nausea, vomiting, or they can develop into shock. And so basically here, rapid cooling is extremely important. And so when the heat stroke, you do need to establish intravenous access with normal saline. You got to make sure that they don't develop congestive heart failure. There you need to have cardiac rhythms monitored, 12 lead EKG monitored. And then also you got to worry about the development of seizures. And so there's medications such as midazolam, which can treat the seizures. When you manage heat stroke, the goal is to try to get the temperature less than 39 degrees, which corresponds to about 102 degrees Fahrenheit. And then the goal is that once you get to the hospital, hopefully, but once you're in the hospital, the temperature can get below 38 degrees, which is like 100.5 degrees. So the goal is get to the patient to the emergency department, give them anticonvulsants, and then for vital sign management, you want mean arterial pressures of 65 to 75. So here, I just want to show you a pictures of how they do active heat cooling. Basically, once the patient's on this bed with the blankets, ice is applied, and then you want to wrap the ice around the patient. So that's the way to do cooling immersion. So then that gets to what are the physiological effects of heat illness? And basically, the cardiovascular effects is something that we have to be very concerned about. And so then you would have to worry about cardiac disease, myocardial infarctions, and also you got to worry about the hemoconcentration, the hyperviscosity of the blood. And so then they're also at increased risk for strokes or clotting to the central nervous system. And then another important organ system that hasn't been discussed as much, but now is becoming more focused, is the kidneys, where you're worried about the effects of chronic kidney disease, or you're imposing acute kidney injury on top of chronic kidney disease. And we think that a lot of the patients in warm climates are getting worsened kidney function in relationship to the climate. However, that's being difficult to prove because there's so many other things that can worsen kidney disease, such as hypertension and diabetes. So it's hard to separate those variables. So I wanted to show you a few studies that came out of Florida about what are the impacts of heat illness in our population. And one of the authors is Christopher Ueho, Dr. Ueho from Florida State University, and he analyzed 67 Florida counties. And basically, he looked into cardiovascular disease, dehydration, renal disease, and respiratory disease. And he found out that higher risks was associated in the Southwest Florida region. He also showed that the counties that had a higher propensity of industries such as farming, fishing, mining, construction, those tend to be more higher risk, as those tend to be more outdoor types of work, where lower risk counties had more industries associated with, say, installation, maintenance, and repairs, which I presume to be more indoor kind of work. An interesting study from, if I can show it, from Dr. Chikas out of Emory, where they did longitudinal renal function assessment in Florida agricultural workers. And what they showed was they assessed renal function and acute injury between 2020 and 2022. And they compared nursery workers from Apopka and fernery workers from Pearson, Florida. The nursery workers, interestingly, were doing tasks such as cutting, trimming, packing, unloading trees. But the thing was they worked on an hourly schedule, where the fernery workers, they weren't paid by the hour. They were paid by piecemeal. So they had to, it was based on the job. And so they were doing cutting, bundling, and loading fern onto their trucks. Well, what was interesting was that the fern workers, their AKI, or acute kidney injury rate, went up from 21% to 43% between 2020 and 2022, while the nursery workers, their rate started off at 11% and remained stable pretty much during the 2-year period. So why such a difference between the two types of outdoor workers? And the thinking is that the fernery workers, they were working by the job, which means they don't want to take breaks. They wanted to, in order for them to earn their salary, they needed to keep doing extra jobs. So the thinking is that the nursery workers had, say, breaks and ways of pacing themselves, ways of hydrating, where they think that with the fernery workers, because they were so pressured to get the next job, they might not have been as cautious in terms of getting their breaks, getting their hydration, and they were more interested in getting more jobs done. And now in this slide, I just wanted to show you what the Florida tracking does in the Florida Department of Health. And what they did was they showed heat-adjusted emergency department visits during the summer months. And this is based on per 100,000 patients. And it's interesting, and if somebody else in the audience could give me an idea, because I've never lived up in this region of Florida, but, oh, sorry, hold on. Okay. But it's these counties, Calhoun, Franklin, and Gulf, that seems to have the higher incidence of emergency department visits. And where we are down in South Florida, fortunately, we happen to be in the lowest category. But you can see there's variability throughout the state of Florida. But I guess one of the goals will be to see what's happening in this region here, such that we can try to get everybody into what South Florida is having. So basically, as I discussed about heat illness and how it impacts people in the Florida region, I just wanted to go over what are the future challenges facing us with heat illness. And one is that as the global population ages, climate change will be an important consideration in healthcare policy. And as you can see, age itself is a risk factor for classical heat illness. Number two is that the kidney appears to be center stage for heat-associated morbidity. It's interesting that global climate experts say that in regions such as Mexico, Sri Lanka, India, Egypt, these are hot rural regions of the world, and they don't have the diabetes and hypertension that we have in the United States. And the people in these regions are getting what they call unknown origin of chronic kidney disease. So this could be a possible way of somehow linking climate to kidney disease. So it's just interesting, how other populations of the world are also getting it based on climate. And then another point is that the frequency and intensity of extreme heat events will increase as global temperature rises, and it becomes important that we develop heat illness-based algorithms of how to, once we see a patient getting heat exhaustion, heat stroke, how do we get that person quickly into our medical emergency activation system? And then finally, I just want to reiterate that the lectures that I give with heat illness have not been with my medical school. I'm a faculty at the University of Miami, and I haven't been able to incorporate a lecture in the primary didactic program where I can teach medical students or residents heat illness. So I think one of the things that should be done is that we need to convince the medical school curriculums that heat education should be a high priority item as part of the core curriculum. Okay, so wanted to show you here. I showed you the slide earlier, and the reason why I want to iterate this is that this is the kind of lecture that I would love to give to medical students and residents. And right now, it doesn't fit into our curriculum model yet. Here are some cards that I want to show you from the American Heart, where they look at stroke. And if you see here, they show you that they want to have, within 10 minutes, assess the patient, within 60 minutes, do a CT scan, and then within 60 to 90 minutes, start thinking about a treatment. And so they have a timing of how to rescue a patient who's having stroke, and then getting them through CT scan, getting them through some kind of treatment, fibrinolytic treatment. And so one of the authors, Dr. Rubley et al. From the Denver University of Colorado system, has one algorithm where they show that in 5 minutes, they want to recognize heat stroke. Within 10 minutes, they want to do rapid cooling. And then in 30 minutes, they want to do continued cooling where they get the temperature below 39 degrees. So basically, this is one form of algorithm which looks pretty detailed of what we could be giving healthcare providers. Right now, there's stuff that's being printed, but right now there's no standardized manual for heat stroke. And so one of the things I wanted to bring to the audience was, how could we take the initiative in trying to develop, say, special educational packets that can be given to all the providers, and then also to non-clinicians as well, because you got to remember, non-clinicians as well get certified in BLS, which is basic life support, or ACLS, which is advanced cardiac life support. So there's ways of getting both clinicians and non-clinicians educated, and we need to get some form of universal standard educational material. And then finally, I want to just go over the collaborations that I have done and the resources that you can look as to how to self-educate on heat illness. I belong to the Florida Clinicians for Climate Action. I meet with the Urban Heat Research Group that tries to do heat research at FIU and University of Miami. And then we do have a report with the Miami-Dade County Chief Heat Officer. And also we were able to get materials from the Miami Fire and Rescue Department. Thank you very much for giving me the opportunity to present this lecture.